Hello everyone, I am Dr. Prashant Jain and I welcome you all to the 48th International Conference on Ayurveda and Fertility on 18th and 19th, 2022, and I welcome you all for this conference which is being organized by Global Ayurveda Conferences and APNA. So in this series of in this conferences, we would be discussing about the Ayurveda and how we can benefit fertility and related issues with the help of Ayurveda and what is the role of Ayurveda. What role does Ayurveda play in the treatment of fertility and related issues? See, when we speak about fertility and related issues, it is not just infertility. It is the very first step from where the fertile life of a female or a male begins. So in this whole session, we would be discussing related to both male and female. Majoritarily, it is discussed with the females, but it is a matter of fact that we must all understand that fertility or the fertility related issues impacts both male and female equally. But when we speak about the fertility specifically, then fertility definitely females have more consideration in respect to fertility. And when it comes to the infertility, then infertility impacts both male and female in equal proportion. That means if you find 100 patients who are diagnosed to have infertility, so almost 50% would be the female and almost 50% of them would be male. So my today's topic and today's the topic of discussion would be related to how stress affects your fertility. Like what role does stress plays in a fertility life or a lifetime of fertile period? See, we all generally knows that the infertility or is a very big issue, but we must understand that it happens, why it occurs, what could be the causative factors for infertility. So before that, we must know that the fertile age of a female or a male starts from the puberty, that would be somewhere around in between 10 to 15, and it ends at for female it ends at the age of menopause, that would be somewhere around 45 to 50, and for male it continues. So that's why today we majorly discuss with the related issues of female and the fertility and related issues specifically with females. So that's been discussed most of the time. But today it is not so. When we discuss about the issues related to female, it equally implies over male as well. So wherever I'm mentioning it is for female, it is not only for females, it would be for males as well. But yeah, definitely when we speak about the stress factor, so it is being seen that stress is mostly associated with females when it comes to the fertility related issues because they have a very long cycle of regular menstruation cycle, which is also get impacts by the stress. So similarly, other issues are also there, and stress factor is majorly associated with females due to their schedule, their time, their management, the responsibilities. What do they have in the field? They have to manage their home, they have to manage their work, they have to manage their kids. So it is almost associated at each and every point with a female. So in this, we have discussed more about females rather than that of males, because males do have a stress factor associated with them, but that stress mostly associated with their professional life or a personal life. But in females, they have to play many roles in their lifetime. So that's why we are focusing more over females out here than that of males. But definitely, yes, all these factors equally implies on males as well. So when we'll speak about the infertility or fertility and the stress associated with that fertility, so it is being seen that infertility is often a silent struggle for all the patients, all the persons who are having fertility or related issues. And specifically, when we'll see 1 out of 8 couples, or almost 12% of married men and women have trouble getting, almost 12% of women have trouble getting pregnant. So that maybe that is not only because of the humans, it is equally that as we have said earlier, it is equally applicable for both male and female. So both are having almost 50% ratio of a fertility or fertility related issues. But definitely, when we'll see more of the issues related to the stress in the females. And when we'll see the females who are having or diagnosed to have infertility or who are unable to conceive naturally, so they have a feeling of depression or anxiety or something, like something is not there, something is incomplete. So that sense of low esteem is very much prominent in all those couples who are not able to conceive. And moreover, when we see those couples, those people, those persons who want to be a good parent, and yes, they would be a very good parent, and when we see them to undergo assistive reproductive treatment, so that again add on a risk, and we have seen that a patient who is undergoing a assistive reproductive treatment, they would be having a high risk of getting psychiatric disorders that may be having a depression or anxiety or some sort of psychosomatic disorder. So these things has been commonly identified in the patients who are going on with the treatment of fertility and fertility related issues. So here a very big question which arises is whether this stress is leading to infertility, or infertility or fertility related issues is leading to a stress. So that is a very big question which has to be understood and which has to be resolved. And we are working on it, and hopefully I would be able to deliver something to you in today's session, that how this cyclic event of fertility and fertility related issues and stress, how this is circulating and generating and causing a lot of trouble to the people. So when we'll see this event, like a patient who is having fertility related issues or who is infertile, further infertility that will induce a psychological distress in the patients. Those patients will identify themselves as having some sense of insecurity, some sense of guilt, some sort of anxiety of not getting, of not being able to conceive. And this would be equally applicable. This have been seen in both in male and female. They both be having same things. They both are having same difficulties. They both are having same psychological distress. The one thing is that one is more expressive, one may not be more of expressiveness or expressive nature. But definitely both the parents share, both the persons, both the couples in a happily married life, they both share the same things, they both share same psychological events as well. So fertility will induce psychological distress, and that psychological distress for again further will lead to the poor well-being of the person, and that will lead to low social adjustment. They are not able to adjust with the society. They're not able to cope up with the society. That one person is having a good healthy child and another one is not having. So that will again create a social stigma. So that is a very big thing which people generally ingrain in themselves, that if they are not able to get conceived naturally, that means something is not there, something is lacking in their life, and they feel that low self-esteem would be there. So again, that will add on. This thing, in some cases, it has been seen that again it will lead to the low marital quality. Like they would be having some struggles or something in between going on with the couples with them themselves, and it will lead to the low marital quality. And so that low marital quality again will improvise the stress, and again it will increase the stress levels of the patient, which will further lead to reduced vitality of reproductive system when marital life is not good. When your marital life quality is not good, then definitely again it will lead to reduced libido. It will again reduce libido will lead to reduced reproductive system and the quality of reproductive system. Again, there would be an altered endocrinology, altered reproductive physiology. Everything will get altered, and again it will progress fertility. So this is a complete cyclic event which keep on happening and happening and happening. And this event has to be broken. This event, we have to stop this event to get occurring again and again. For the same, first we need to understand that how this event works, how this all these things happen. So when we'll see the different type of stress are present in their life, those are the main positive factors why these cyclic event get created. See, as we can see here, a girl is sitting isolated. So that in the childhood, these all things start from the very early, very beginning of the age. It is not like all of a sudden all these things starts. It starts at a very early stage of life. So if the kids, they have seen their parents not in a good shape, not in a good state every time, all the time. So that creates a psychological trauma over of the child. And from that very particular age, that's as we have discussed earlier as well, that the fertility and related issues starts from the age of puberty. So if at that time only we address them and we recognize them, identify them, and we get treated. So from the very beginning of the fertile age, then problems of infertility may get reduced in the later stages as well. So that has to be identified at the very early age of life. So similarly, we are seeing a kid who's seeing all these things, so that will create a social trauma and psychological trauma over them, and that will further lead to the impaired hormonal system and further aversion towards all these system of marriage and fertility. So that will again worsen the case. The stress related to the day life, stress related to the work, stress related to your professional life, stress related to the someone the loss of a near and dear one, that will also create a psychological distress in the patient. The stress related to the financial problems is also a very big thing, which plays a major role in your psychological state and in your emotional state. So stress may be a emotional stress or a family or a personal or psychological or a professional. Everything happens and everything add on to the that. And these stressors, until unless they are present in the life, they will be having some one or the major or the lower impact over your fertile age or your over your fertile life. So we must understand how this cycle of stress works and how all these things happens. So I would try to sum up the things in short because as we all are doctors here and we would be knowing all these things. But still, just to remember everything, that we have a system which is known as limbic system, which basically controls all the emotions, all the activities of the body. The complete hypothalamus pituitary ovarian axis is also controlled by, or the hypothalamus pituitary testicular axis is also controlled by the same limbic system. So when we see the functions of limbic system, it includes that it plays an important role in emotions, learning, memory. It also plays role in the aggression, eating, drinking, sexual behaviors, and it also plays role in monitoring the blood level, glucose, salt, blood pressure, and hormones. So when we see all these things, we must just remember what we used to call a pranavayu, dhanvayu, samanvayu. So if we see the functions of pranavata or the functions of udanavata or the functions of samanvata, we can easily correlate with the functions of limbic system. Like if we'll see that pranavata murga, urikanda, pranavata murga, Stevenam shretu udvar, nishwas anna, and it is also the seat of mana. Pranavata is also directly connected with mana. So it also controls your emotions. Udanavata, urasthanam udanasya nasa navi galascharet, vak pravrati, bayat uja, balvan smriti kriya. So that is also here that it creates the memory. Balvan smriti kriya. Samano Agnipa Samipastha Koshte Charati Sarvata Annam Granati Pavsi Vivechayati. So Samanuvat is also responsible for all the circulation of all the hormones all over body. So all these Pranavata, Udanvat, Samanvat, Apanvat, Yavyanvat, all these things are very much related with this limbic system. And also, as it is said, that Pranavata is directly related with Mana, and Mana is also present in the limbic system. The functions, emotions which is generated by Mana is also control center of limbic system. When we speak about the hypothalamus pituitary ovarian axis, though, that is also a part of limbic system because hypothalamus is present in limbic system. So whenever this limbic system pranavata get vitiated or there would be a disturbance in pranavata, that will affect the limbic system. So pranavata affected got means there would be effects there would be some bad effect over the month. And when one will get disturbed, it will also disturb all the other factors, the pranavata or we can say the limbic system. So here how it happens, whenever you have some psychological effect, there would be disturbance in the mana, and that man will further lead to disturbances all the body functions. So similarly, we can see here, if there is a disturbance in your emotional state, that disturbance in the emotional state of the hippocampus that will directly affect over the limbic system and it will further alter the secretions of hypothalamus. So as we all know, what hypothalamus does, this is the hypothalamus pituitary ovarian axis. Hypothalamus secretes GnRS, that is gonadotropic releasing hormones, which further act on the anterior pituitary and which will release luteinizing hormone and follicle stimulating hormones. See, when there is a difference in this hypothalamus, when there effect over the hypothalamus due to the vitiation of mana, due to vitiation of pranavata, or due to hindrance in the limbic system, this hypothalamus will get affected. Due to this effect over the hypothalamus, further the releasing of GnRH will get affected. Like the gonadotropin releasing hormones, it would not be secreted properly. And when this factor will alter, it will further alter the luteinizing hormone and stimulating hormone of the body. So once these two things will get altered, so these gonadotropin releasing hormones, so it will act on the gonads and there would be reduced production of estrogen or altered production of estrogen and progesterone in females and reduced production of testosterone in males. So ultimately, what happens here? The psychological stress or the emotional stress which was present, which is there for the limbic system, which is present in the limbic system. This limbic system will get disturbed due to the emotional state, which further disturbs the hypothalamus, which controls the releasing of gonadotropin releasing hormones. It will further disturb anterior pituitary and lead to production or least production or altered production of LH and FSH, luteinizing hormone and follicle stimulating hormone, which further disturbs the production of estrogen and progesterone and testosterone, all the three. In males, it disturbs the production of testosterone. In females, also it disturbs the production of estrogen and progesterone. If there is a high amount of progesterone, there would be no ovulation. If there is low amount of estrogen, there would not be any ovulation. So these things will get altered, and which will further lead to alteration of entire fertility cycle and entire fertility system, and ultimately which leads to infertility. So again, as we discussed earlier, it is a cyclic event. Like now, if you understood here, when there altered production of gonads, then what it happens? There would be low production of estrogen and progesterone. Further, there would be low sex hormones. Low sex hormones means there would not be enough production. Then it won't signal it further. So low production of estrogen and progesterone won't signal further to the hypothalamus. There would be further reduction, further alteration in the complete system or secretion of the hormones here. So that's how it creates a cyclic event. That if you have a high level of stress, this will further induce. This is the high level of stress, poor well-being, low social adjustment, low marital quality. This is the emotional factor. This further disturbs your reproduction, which will have low altered endocrinology, altered reproductive physiology due to affection over the hypothalamus pituitary axis, ovarian axis, which will induce infertility. This infertility again, it will induce a stress factor. It will become a itself. It becomes a major stress factor for the people, and again the cyclic event continues. So this cyclic event continues until unless we stop it completely. So how to stop it? Definitely there would be a case of management, that how we have to manage this case, how we have to break this cyclic event. Until unless we break the cyclic event, it won't benefit anyone. It won't benefit the male partner, it won't benefit female partner, it won't benefit a treating physician either. So you can keep on giving medication, but until unless you break this cyclic event, it won't be giving any benefit to anyone. So first, to treat the cases of infertility where the patient is also associated with stress. And believe me, I have personally seen in my clinical practice of more than 12 years that the patients who are under this infertility related issues, they are having high level of stress. And definitely whether the infertility occurred because of anything, but after patient becoming infertile, once a patient becomes infertile, they would be having high level of stress, and which will further add on to the which will further act as the aggravating factor of infertility. So this cyclic event needs to be break down to treat the cases and to get benefited out of it. So how we can manage it, how we have to break this cyclic event. So, in when we see the treatment principles of Ayurveda, Ayurveda clearly explains Daivya-Pashraya Chikitsa, Yukti-Vyapashraya Chikitsa, and Satvavajaya Chikitsa. All the three treatment protocols have a very, very, very good role and have a very important role in managing cases of infertility. It is not like that when you see you see the reference of Devya Chikitsa and you see the explanation of Devya Chikitsa, it is clearly mentioned that it is Ashu Vyadhi Haratvena. That's why it is first said. First, you have to do Devya Chikitsa, then Yukti Vyapashraya, and then Sattva Vajaya. Sattva Vajaya is at last because the effects of Sattva Vajaya is not seen directly. It will definitely have effects over the treatment. When Dev Vyapasya Chikitsa is Ashu Vyadhi Haratvena, it will cure the disease, it will act over the disease very fast. It acts as a catalyst, it emphasizes the treatment, it also supports the treatment, undergoing treatment, whichever you are planning with your yukti. So in Dev Vyapasya Chikitsa, the person who believes in Deva, who believe in God, to definitely you ask them to perform the rituals whichever they do on a regular basis. See, it not only benefits it is not like having some misfaith or something, but it also if a patient is following their dietetic or their rituals properly, so definitely they'll get bind to certain rules and regulations. And in most of the cases, like for a very simple example, if we'll see the persons who are in regular indulgence of alcohol or smoking, when you ask them to follow some diet chikitsa, then they will get bound to some certain rules and regulations that they need to quit smoking and they need to quit alcohol. And quitting smoking and alcohol itself helps in the treatment because that is the major factor which is present in today's lifestyle, and it is leading to a very drastic change in your fertility cycle, and it is impacting over your levels of hormones and over your quality of ovum and quality of sperms, which is getting affected due to these psychology, both these lifestyle factors of alcoholism and smoking. So when they'll get bound to this niyama and vrata, they'll definitely quit, and it will help you to plan a treatment properly. When they'll pound Akshay Sutra, they'll do Japa, they'll do Homa. So that will give some sense of positivity to them. And due to that positivity, again, the stress levels which are present, that stress levels will get reduced. And once that is the only aim, right? What we are discussing out here is how stress is causing infertility. And when you are reducing the stress levels, when you're giving some hope, see, everything is depend upon the. So ultimately, what you need to give hope is the biggest healer in itself. A person who is having a hope. If you ask to a patient who is diagnosed with depression, the three major symptoms of depression are hopelessness, helplessness, and worthlessness. So if a patient who's having a hope, then half of the treatment is done, right? So that I have seen personally, half of the treatment is done. So hopelessness is the one such factor which has to be removed, and by this Daiva procedure that gets removed. Next, when we come to the Yukti Vyapasya, definitely we'll plan treatment for the fertility and related issues, but here we are discussing stress related to fertility. So you need to eradicate stress. So for what you need to do, you need to boost up the feel good factor of brain, feel good hormones of the brain, feel good neurotransmitters of the brain has to be improvised. So when we know that dopamine or serotonin, these are feel good neurotransmitters, so which has to be improvised. As we all know that Kapikachu, rich in L-dopa, right, direct source of dopamine. So this should be given Brahmi, Chata, Mamsi, Shatavari, and number of major drugs are mentioned. So as per the yukti of the Vedya, whatever he is seeing, more of the anxiety or more of a depressive state, accordingly he can plan. Like Kapikachu can be given in a depressive state of the patient, and the patient is having more of the anxiety, then at that time ashwagandha can be given. So both the drugs have to be given in a managerial form, like how you have to, what are the present complaints of the patient, accordingly we have to plan the treatment. And last, coming to the Sattva Vajaya, again, what all can be done to remove the stress, like Ashwasana. The first one is Ashwasana. Just you counsel the patient, just you say patient that yes, you could be a very good parent in the future. Definitely some issues are there, but those issues can be removed, can be resolved. That is the only thing which can be done by which only patient will get positive. So Ashwasana is the first line of treatment for them. First line of treatment as a Sattva Chikitsa to conquer their mind, to just help them, to give them a hope is a very good healing process by in itself. Next, when we'll come to the Sadvrata Palana, like the daily regimen should be followed in a very good way. If the patient follows, if the patient leaves all the misconducts, all the bad habits, no junk food, very sattvic food should be taken. There should not be any bad habits of alcoholism or smoking. Everything has to be removed. Yama, niyama, asana, dhyana. Pranayam plays a very good role in such things. Like if you start patient with a pranayama of doing Puraka Kumbhak Rechak, all the three needs to be done. This will holding of breath and controlling breath will give control over oneself, it will give control over one's emotions. And if a patient learns to control their emotions, that will benefit him along with the treatment aspect. Taking niyam, bounding them in the rules and regulations, doing asana. Asana again, it will again strengthen the pelvic area, it will again strengthen the pelvic muscles, it will give strength to the uterus, it will give strength to the sexual organs. So definitely it will give much more help to the area. And dhyana, meditation again reduce the stress levels. When a person does the meditation, it will reduce the stress levels. It will increase the, and it will also, the main benefit of dhyana is that it gives you the insight. See, if a patient is having a very anxious mood, if a patient is very much angry over something or mood is disturbed, and you ask them to do meditation, when he sits down and meditate, he will find the solutions of all his problems. And once a person finds solution of his problems, definitely the quality of his emotions will improve. Because why he's getting temper, why he's emotionally disturbed, because there is some problem which is going on and he's not able to find the solution for the same. So at the time of meditation, what happens? All the problems come in front of your eyes and you'll try finding out the solution for all of them. And eventually you'll get the solution. As soon as you'll get the solution, or half of the anxiety will get removed. So that this is a very good state of mind. So definitely the three treatment principles should be planned, Daivya Pashraya, Uttiya Pashraya, and Sattva Vijaya, for all the patients, whoever in whichever form you would like to. That depends upon the yukti of the treating Vaidya, that what needs to be done at which point. And when one thing is done, it will benefit the other one. Some common things how you can reduce the stress is like doing a regular exercises, listening to music, meditation, what we spoke just now, joining fitness and mentally, again, the same yam niyam asana what we have spoke about right now. So definitely doing asana is also a type of exercise or fitness or mental exercises that can be done. Mindfulness, knowing the cause of disease, what we have discussed in dhyana. So knowing the cause, knowing the reasons why you are having anxiety, why you are distressed, why you are having emotional troubles, why there is misunderstanding between the couples. There could be n number of things. So mindfulness, knowing the exact cause of the thing would be a very good help to the person, right? Muscle relaxation techniques, when a person is getting anxious, at that time, if you teach him the muscle relaxation techniques, so every time person will get anxious, they'll do the exercise and the muscles will get relaxed. Once muscle will get relaxed, half of the anxiety will get reduced by itself. So you need not to put a patient on medications for each and every time for each and every anxiety or panic attack or depression. Those can be managed with handful of exercises. So please advise them to do exercises, to do meditation, to do yoga daily. That will help them to reduce their anxiety levels and it will definitely help them to break the cycle. What we have discussed earlier, it is a cyclic event. So this cyclic event will get break down once you reduce the stress levels. So after reduction of the stress levels, when the patient is not having much of the stress, definitely you will start with the treatment protocols like what we have mentioned here, Kapikachan, Shatavari, Ashwagandha. All these medicines are both there. They also promote the fertility health. They also reduce the stress levels. So they can be administered in both ways. Next, when we see other or another thing, what we can do, like indulge in meditation, what we have discussed here, open the conversation with your partner is a very good approach to reduce the anxiety, to reduce the stress of fertility and related issues. Avoid isolation and being alone. Be in a circle of emotional support. Right. So increase your knowledge about the topic, like what we discussed mindfulness, it is the same that increase your knowledge about the topic, about fertility and related issues, about infertility. See, if a patient is having insight about why it is happening, then they can correct it. If, for example, like what we have discussed earlier as well, patient is alcoholic. So definitely the alcohol will have a very bad effect over both ovum and sperms. So person who knows that the alcohol will further deteriorate the quality, they'll stop alcohol and then the quality of sperms and ovum will get improvised with the help of medication. So getting insight about the problem is very important. Avoiding indulgence in caffeine and other stimulants. Try freeing yourself from physical and emotional tensions by exercising regularly. So when you exercise, your body is hormone level will get boost up, and you will get away from the daily routine stress and anxiety causing things. So this is the thing which we have to discuss and we have to address, that how this stress, which is least considered in the market, which is least considered when it comes to the treatment of the patient. So how this stress causes anxiety, how this stress causes fertility, how fertility related issues, how this stress alters the fertility of a person. So these things need to be addressed and need to be noticed, and accordingly the treatment has to be planned for a patient. So furthermore, if any of you would like to discuss anything with us, you are most welcome, and we would like to hear about your experiences here at this platform. And once again, I would like to thank Apna and Ayurveda Global Ayurveda Conferences for organizing this wonderful session and for providing such a vast knowledge to uh, all the persons in the world, that how we can help out, how with the help of Ayurveda we can treat fertility and related issues, how Ayurveda sees fertility in person, how Ayurveda addresses the fertility, how Ayurveda addresses infertility, and along with me there are a number of other spokespersons are there who are sharing their vast knowledge of Ayurveda and specifically related to fertility. So once again, I thanks Apna and Global Ayurveda Conference. Thank you. Thanks a lot.